Good afternoon. Myself is Dr. Neeraj Goyal. I'm a consultant urologist and andrologist practicing at Alchemist Hospital Panchkula, Chandigarh. Today we are going to talk about who's an andrologist and what are the diseases covered. An andrologist is a specialist urologist, is actually a subspecialty of the urology who deals with the men's sexual problems like erectile dysfunction, premature ejaculation, male infertility, and other problems that are related to the male sexual health. Today we are going to talk about uh, erectile dysfunction, what are the various types of erectile dysfunction and what are the remedies available for that. So there are, as we know that the erectile dysfunction, it's quite a common problem and it's increasing recently of late, it's increasing in incidence, and it's increasingly it's becoming the cause of so much of mental stress and even breaking of many marriages. So it's a serious problem. The most common type of erectile dysfunction is in fact what is called as a psychogenic erectile dysfunction. Psychogenic, we can say that there is no underlying basic cause, but it is related with some sort of psychological stress. There are different types of psychogenic erectile dysfunction which may be like uh, regular, or it can be incidental, which can be related to some specific place, some specific person, or some specific type. And this is the most frequent type of erectile dysfunction, especially in the young population that we get to see. And I must say that this is one of the most easy type of erectile dysfunction, and responds very well to the proper treatment. The main treatment for psychogenic erectile dysfunction is the that we have to find out, we have to pinpoint what is the psychogenic, that factor which is actually causing erectile dysfunction. If it is a factor that can be removed, that is the most important thing. Then there is sexual counseling or psychosexual therapy that forms an integral part of the treatment of psychogenic erectile dysfunction. And the third is the various drugs, medicines, which we have to start to treat the erectile dysfunction. And as the person comes out of this psychogenic stress or the causative factor, we can wean off the drugs gradually. And the second most common is what we call as the hormonal erectile dysfunction. There are various hormones, like the most important beings testosterone, that we all know is related to the male sexual function. So a sort of deficiency in the testosterone can lead to erectile dysfunction. Most commonly this is a temporary type of hormonal deficiency which may be associated with some sort of psychogenic stress, again or a work related stress, or some sort of physical illnesses, prolonged illness in which the production of the testosterone in the body is reduced temporarily. Or in the advancing age, after the middle age, we can say there can be permanent deficiency of the testosterone, what we can cause as these days called as andropause. And then third, there can be certain disorders of the from the childhood, or the by birth disorders where there is low production of testosterone. So all these factors can lead to the hormonal type of erectile dysfunction. So the most important things for these factors is to find out the cause of the deficiency. If we can pinpoint that cause, we have to treat for that particular cause. And then the hormonal replacement therapy, if we is the is an important aspect for the treatment of hormonal. Apart from the the various factors that can help is to avoid the sedentary lifestyle, to maintain some sort of physical activity, to maintain good levels of testosterone, and to avoid all types of mental stress. In the third comes the vasculogenic erectile dysfunction. In vasculogenic erectile dysfunction, this we get to see more and more commonly, especially in the middle age, those patients who have associated heart disease, diabetes, so-called metabolic syndromes, then hypercholesterolemia, chronic smokers, alcohols, high intake of alcohol. All these factors contribute to a type of vasculogenic erectile dysfunction. Means the blood supply to the erectile tissue is compromised at certain stage. Then the last and the least common type of erectile dysfunction is neurogenic erectile dysfunction. This is usually associated with some sort of either local trauma or spinal cord trauma or other disorders which affect the spinal cord functioning or brain functioning. This is a very rare type of erectile dysfunction, and we usually get to know from the history, physical examination, and different tests that this is the type of neurogenic erectile dysfunction, and these are the patients which are actually difficult to treat. So, if you are suffering from erectile dysfunction, please don't ignore this problem because it's having a long lasting effect. It can affect your married life, and it can lead to many broken marriages. Please consult your urologist, who's a specialized person to treat all these disorders. Take care, stay healthy, stay safe. Thank you.